and the head of critical care department of Kuwait Bangladesh Motri Government Hospital. I am working here from the beginning of the pandemic in Bangladesh ICU setup for the COVID patient in this COVID dedicated hospital. I am working here since last uh, February 18, 2020 to till now.
Thank you. Dr. Alfredo?
Well, hello, everybody. My name is Alfredo Mena-Lora. I'm an infectious disease specialist. I'm an assistant professor at the University of Illinois at Chicago, where I direct the infectious disease training program. And I also practice infection prevention and antimicrobial stewardship. And I'm a board member at MedGlobal, and I'm excited to talk to all of you today about these important topics. I want to apologize in advance. It's 10 a.m. in Chicago, and I have children with me because one of them is not in childcare, so I may have to turn off my camera, and you may hear loud children. So I apologize in advance.
No worries. No worries at all. We're really excited to have you with us and your children as well. Dr. Nahreen?
So hi everyone, and assalamu alaikum to everybody in Bangladesh. My name is Nahreen Ahmed. I'm an assistant professor of clinical medicine in the Division of Critical Care at the University of Pennsylvania in Philadelphia in the US. I'm also second generation Bangladeshi. Both my parents were from Dhaka Medical College, K29 batch, so very proud to be here today to talk to you all about the current COVID situation, as well as any questions we can answer about the vaccine, given how important it is. So very happy to be here with all of you, and special thank you to Dr. Asad for all the work he's done and all of the critical care physicians that are really working so hard in the situation. We're very happy to have you here, and so glad you could make it. I'm also, with Alfredo, a board member of MedGlobal as well.
Thank you. No, we're lucky to have all of you here, especially as at a time when we know that your profession is demanding so much of you every day. So really grateful for all of your service. Would love to hear. Let's start with Dr. Asad. Actually, we are hearing in the news that the ICU beds are all filling up within Dhaka and across Bangladesh. What are you seeing from your perspective, and also, I think, what would your advice be to Bangladeshis who are feeling very anxious right now?
This is very true. The number of COVID infected patients increasing day by day from the beginning of the March. Before March, in February, the number of COVID affected patients and number of patients who are seeking the ICU support is very low. Even in my hospital, some of the ICU beds were empty. But from the beginning of the March, we cannot provide support to the patients who are requiring ICUs in my hospital. So the number of cases is increasing day by day. But the number of ICUs in the private sector is more than 1,000. But most of the ICUs in government sectors is occupied from the first week of the May. And so many patients in my hospitals and other COVID dedicated hospitals in the country cannot ICU to that people who are requiring support. From the second week of March, the private ICUs, maximum private ICUs, are also filled up by the patients. So the number of patients increasing day by day. You see the number of infected people today is 6,800 plus. So if 1% of these patients requiring ICU support, it is 680. So we cannot provide that much support to the patients. And it is very wiseful thinking to protect against the COVID so that we are not infected by the COVID-19 virus. And even in the general ward, the number of patient is overflowing. So we have to reject so many patients every day. We cannot provide even general bed to the patients. So the situation is alarming and grave. So we have to be very careful about the COVID-19.
Thank you. Thank you so much. I think Dr. Alfredo, can you explain to us a little bit about how the virus works and how the vaccine helps to protect against it?
Absolutely. So it's important to, I think in general, to protect ourselves and to protect society, to kind of recognize how the virus transmits itself. And this is primarily, like most respiratory viruses, this is primarily a droplet type of kind of infection or transmission where your drops of saliva of varying degrees of size can travel throughout the air and then fall or drop into the floor. And that's why in general we try to keep 6 feet apart. Like most respiratory viruses as well, there is a small percentage of patients that might, or situations that might have what we call airborne transmission, which is that the droplets are so small that they float in the air for a bit. That seems to be very rare and probably not driving the infections between people. But the most important factor is really the fact that about 40% of patients are asymptomatic. And 40%, even 50% of the people who develop symptoms are transmitting, 3 days before they develop overt symptoms. So in the setting of a pandemic, we have to assume that anybody may be carrying and transmitting the virus. And that is true at work, and that is true at home, to protect healthcare workers and family members, et cetera. So
Yeah,
that's how the virus
absolutely.
transmits itself. And, these droplets, they can fall on a table, they can fall, they can certainly get infected. They can certainly contaminate other surfaces. And then there's a possibility that you can touch that surface, touch your eye, and so forth. So the use of protective equipment is important in the hospital, and the use of social distancing is imperative in outside of the hospital. With regards to how the vaccines work, we have different types of vaccines, but in general, they all follow a similar process. About a year and 3 months ago, when the genetic code of this vaccine was shared throughout the world, people started, we essentially selected the spike protein of the virus, which is a small little part outside of the virus where it connects with the cells in the body. So we selected that protein as a target for our vaccines. And throughout the board, all of these different vaccines essentially just deliver that information differently. So, for example, mRNA vaccines like Pfizer and Moderna deliver that through an mRNA technology. Johnson & Johnson delivers it through what's called an adenovirus vector. AstraZeneca uses a chimpanzee adenovirus vector, also known as ChAdOx. So there's different ways to deliver the information, but ultimately they are all targeting the same thing. And by doing so, we develop antibodies and other mechanisms to protect ourselves from the virus when we do get exposed to it.
Thank you. And just to update everyone here on the latest from Bangladesh. So to date, 5.3 million Bangladeshis have received the first dose of the Astrozeneca vaccine. Well, it's the Covishield vaccine from the Serum Institute of India, which is manufactured according to the, to the parameters of the AstraZeneca vaccine. The Indian government, due to the crisis they're facing in their country, have temporarily paused export of that vaccine. But the Bangladesh Health Ministry has recently announced that they will be purchasing vaccines from Johnson & Johnson to reduce the dependency on India. And UNICEF and ADB will be facilitating the purchase of those vaccines. apparently the health ministry will also be allowing private imports of the vaccines, but there's not much information on the timelines on either of those, to be honest. So the question is there any scientific study if the AstraZeneca vaccine in Bangladesh is working?
Still not, because uh, we are not getting the second dose yet. Every vaccine, the Covishield, which has give you the protection after second dose, 2 weeks after the second dose. So the person who get the first dose will get the second dose in April 8th. So we have to wait. The vaccine is working or not. We have to wait up to 20th. So we are finding so much patients. The patients have taken the vaccine 1 week or 10 days back is suffering from COVID-19 disease. The reason behind
Right.
it, the people of Bangladesh are thinking that they get one dose of vaccine, they get immunity. That's why they are not using the face mask. They are gathering in the various places, and they are not maintaining the social distances. I ask my patients, why are you doing so? They told me that we got the vaccine and vaccine will give protection. But this Covishield vaccine will give protection
Sorry, I think Dr. Asad is maybe facing some internet issues.
And I can jump in here, and I
Thank you.
don't think we need to. Oh, he's back. Okay.
the
Yeah, so I
vaccine is
think the technical difficulty with
working
the slide
properly.
is an issue. Alfredo,
And
you want to just jump in?
Sure, and I think we may not need the slides based on the questions we're getting. I think the key question here is, do the vaccines work? And the answer is yes. The vaccines work. They protect against infection, and this is true for all of the different ones. But more importantly, though protection may not be 100% with regards to acquiring disease, protection is very high with regards to protecting against severe disease and hospitalization, which truly is what matters the most. Now, these vaccines and this virus is not static. The virus mutates, it changes, and therefore the efficacy of these vaccines might change as well. So at the end of the day, we are in a race against further mutations of the virus based on the vaccines that we currently have. So what has this meant? The early vaccines were very effective because they were tested in an environment that was more similar to that genetic code that was shared in January, of which the vaccines are made of. Since then, Johnson & Johnson, for example, the vaccine result there was still pretty good. The efficacy was a little bit lower, and lower in certain countries, which we'll get to in a second. But it was lower, but still extremely protective against what really matters, hospitalization and death. Mm-hmm. So where was Johnson & Johnson less effective? It was less effective in South Africa. It was less effective in Brazil, where the rate of infections has been such that the virus has had the ability to mutate and to change. So going back to, does it work, and does it work in Bangladesh? In general, getting the vaccine is better than not getting it, period. Because even if you get an infection after the vaccine, particularly after you've given time for the vaccine to work, you're more likely to, you're less likely to develop severe disease, period. But, we need to continue to protect ourselves as if we didn't have a vaccine. We have to continue to do social distancing and everything else, because that's more effective than a vaccine.
Yeah, so I think the most important part of what is being said is that, one, we know that it's possible to still transmit virus because none of these vaccines are 100% effective in preventing acquiring the virus itself. So that's really, really important. What that means is that even if you get both vaccinations, both shots, that you're still at best 80% protected, or 80% effective is the Astrozeneca virus vaccine against the virus. Now, that still means that you're able to acquire it, you're able to transmit it, meaning you can get the virus and pass it on. But the most important piece is that the goal is to prevent hospitalization, prevent being very, very ill. Because as Dr. Asad mentioned, the hospital impact of this is very high. Patients are in the ICU, the load on the hospital is very high, such that patients are taking up all of the spots. We're unable to actually give people space in the hospital. So the important thing is that the vaccine is meant to prevent severe illness, but we know it may not prevent 100% actually getting the virus. And there's a difference between having the virus and having the COVID disease. The virus itself, when you have it, you might be asymptomatic, you might not know that you have it, but you can still transmit it to others. So that means, as we're all saying, it's important that even after you get your vaccine, to continue to wear your mask, to continue to distance from each other. The whole point being that the less virus that's circulating and the more people that are vaccinated, the safer it will eventually be, but we are not there yet. We are definitely not there yet. And that false sense of security that Dr. Asad mentioned, we're also seeing that in the US. People getting vaccinated and thinking that this means I have a free pass, I can travel as I want, I can be around others without a mask. But we know that that is not true quite yet. We still have a way to go before that's done.
Thank you. Absolutely, so grateful for these messages that I think we all need to remind ourselves of, even if we've been hearing them. I think there's some great questions that have come through, actually. One question is, some people are saying that once a patient becomes COVID positive, there's no chance of getting infected a second time. How accurate is this statement? And I think embedded in that is, if you've had COVID, do you even need to get a vaccine? Dr. Nahreen, maybe do you want to field that one, or Dr. Alfredo? Yeah, either one.
So this is tricky, right? So it is not guaranteed that if you get COVID one time that you cannot get it again, and the reason for this is many things. One, the original COVID virus or SARS-CoV-2 virus that was circulating last year is not the same one that is circulating now. And so what that means is that if you were infected early on, it's still possible to become infected again later on. Now we're seeing second time people are being infected with COVID and the virus itself and becoming symptomatic. And although we're not checking to see if it's the new strain, the likelihood is that it probably is one of these new strains. So that means that on top of that, the immunity that comes with illness, we don't know necessarily how long that lasts. And so that's why there was so much caution to say the vaccine itself might only be effective for 3 months, that if you're sick, that immunity from having COVID might only be effective for 3 months, because we're still collecting information we don't know for sure. And we know that the nature of viruses is for them to mutate. And by knowing that, we know that there's a likelihood that people might be able to get sick again from a different strain altogether. And so, yes, it is possible to get sick again. It is not guaranteed that you will not get COVID again if you had it the first time, but maybe you won't be as sick because there is some immunity. And those are some of the things that we're still learning about. Alfredo or Dr. Mena-Lora, I defer to you to add to that as well.
Yes, absolutely. And I apologize for some of the child noises, but in general, there's a significant historical, I guess, parallel here, which is a few months ago, recent history, I guess, in Brazil, the city of Manaus had a very drastic first wave of infections that reached over 70% of the population, estimated percent. And based on these same questions, folks thought that they might be protected and we should be okay. Well, their second wave was larger, impacting a lot of people a second time because the virus changes and because our natural immunity seems to be inferior to vaccine immunity, and it's estimated to last, anywhere between 60 to 90 days.
Great. That's extremely helpful. Another question is, what is the difference between the different vaccines? You've all alluded to that in your answers, but is getting the Johnson & Johnson vaccine the same as getting the AstraZeneca or Moderna one? If not, what are the differences?
The difference between the vaccines?
Yes.
In general, as I mentioned, the vaccines target the same protein. So they're all pretty good, and they all work similarly with different delivery mechanisms. When you see the difference in efficacy, it has more to do with what's happening on the ground at the time and in the place where those vaccines were tested. So in general, all of the vaccines are very effective. The best vaccine for you is whichever vaccine you have available. I got vaccinated with Pfizer. My parents, who live in the Caribbean, got vaccinated with Sinovac. In general, I've had friends vaccinated with AstraZeneca and multiple other different vaccines, because the best vaccine is whichever one you have available.
Thank you. I have another question about the view, from the scientists in Bangladesh. Has there been any evidence of antibody development among patients in Bangladesh since taking the first dose? Dr. Asad?
There is no collective data. Some of my colleagues tested the antibody. Some of them, the antibody titer is very much strong, and some of them have very weak response. So it is very much difficult to tell the response of vaccine. I must say we should wait for the second dose, and then we can say what is going on.
And I will add, we are doing studies looking at antibody titers, and yes, antibody titers should go up after a vaccine, but it's essentially uninterpretable. You cannot make any clinical or any type of decision based on antibody results. So I wouldn't even test myself for antibodies or anybody else, because it's really not helpful.
Yeah, and to add to that, that's mostly because the body's immune response is very complicated, and we are unable to measure that in a lab. And that's why in testing antibodies, that's not the whole picture. There are so many other parts of an immune response and immunity that we are unable to really test. And so that's really why the antibodies themselves are not necessarily the key to answering that question, are we immune or not? Because it's such a complex process where we're unable to really measure that. The real measure of that is whether people are getting sick or not, and seeing the information as we move forward about the number of people becoming severely ill. And when you get the realistic data, which is where we get that effectiveness number, meaning how helpful or how beneficial is a vaccine in real life outside of the trials that are being done. And when we're seeing all of that, the information is hopeful so far. It doesn't seem that way because people are still getting sick, right? But the important thing, and I see it coming up in a lot of the questions, is, well, how immune am I if I get the second vaccine because I had a family member that got sick only after a week of getting both doses of their vaccine? And the importance of that is that the immune response, again, is complex and it takes time to build. So after being vaccinated, it can take several weeks. For the Moderna and Pfizer vaccine, we say only until 2 weeks after you've taken your second vaccine are you protected. That does not mean 100% protected, but protected enough that we think that you will not get severely ill such that you will be in a hospital. Similarly, same thing for the AstraZeneca, same thing for Johnson & Johnson. There's a period of time, up to a month for some of these vaccines, where until after that period of time are you protected with the numbers that are being quoted from their research studies.
Thank you. We have some people in Bangladesh who are doubting the quality of the vaccine that's been available in Bangladesh because it was produced in India. How would you respond to those concerns?
I would say that most antibiotics, most drugs throughout the world, including the United States, are imported from India. And it's a powerhouse of production. And I if you weren't concerned about your blood pressure medications, you shouldn't be concerned about the vaccine.
Yeah, I would agree. I would second that. You know, the UK, most of Europe is using the same vaccine, and that's coming from the same location. I think that's important to recognize. It's also important to recognize that all of the studies that were done, even with the Astrozeneca vaccine as well, because I know it's come up that does the vaccine work differently in different ethnicities? The vaccine itself was studied in various ethnicities and has not shown a major variance. There was a survey recently done of Bangladeshis. It's a small population, like 1,300 people that were asked, why are you hesitant to take the vaccine? And that was one of the answers, that it doesn't work. We don't think it works as well, or it might not work in Bangladeshis. And so again, the vaccine is effective. The one that you're getting in Bangladesh, it's exactly the same mechanism as being used in the UK and many parts of Europe, and also should be as effective in Bangladeshis as it would be in any other background.
And I always want to add that these vaccines were not, in general, an effective vaccine, a safe and effective vaccine was not a given. We are lucky that we have this tool, and we have to use it, and therefore protect ourselves, reduce the rate of infections, and reduce the mutations that can later render the vaccines less effective. And in some countries, this race has been slower, and you know, the vaccines have less efficacy. So it's important for us to do our part now.
Yeah, and I think to add to that, the important thing to remember is that we have had vaccines in the human race for a very long time. None of the vaccines in our history of humanity have ever been 100%. That's important. That's important to remember, that's not the case with any vaccine. And so that's important. But with those vaccines, we've been able to stamp out many different diseases. In fact, vaccine hesitancy, according to the WHO, is one of the 10 biggest health threats, because vaccine hesitancy is preventing us from stopping or mitigating all of these diseases that can be prevented or mitigated by vaccines. So it's a really important thing to remember, that effectiveness or efficacy of this percentage is not very different than other vaccines. You know, your chickenpox vaccine and all the other different tetanus vaccine, all of those other things. It's important to remember that.
Thank you. Absolutely agree. I personally have gotten vaccinated, and almost all of our team at Praava have also gotten the vaccine, and so we strongly encourage everyone to definitely get their first dose when they can, and then make sure to get your second dose when they can. I think we're hearing this message loud and clear from all of these experts. And another really, really great question: if you get the first dose of the vaccine and then you test positive for COVID, do you still get your second dose as scheduled, or does that affect the timeline for the second dose?
Alfredo, do you want to take this one?
The question is whether to wait for the second dose?
Right. If you get, so this is from Tammy Hunphy, if we get COVID after the first dose, when should the next dose be given?
So this goes back to natural immunity as well. So natural immunity, it is expected, that you are protected probably for 60 to 90 days. That is not certain. The variants can change that, etc. So here in the United States, the CDC body that provides recommendations for vaccines essentially recommends that everybody get vaccinated, even if you just got COVID. So they want you to wait 10 days, the 10 days that you have symptoms and need to be in quarantine. And then after that to resume or get vaccinated. That said, the CDC also mentions that if supplies are low, then given the fact that the likelihood of an infection in your first 60 to 90 days is very low, you can defer until then. So I think you basically have two answers to this question. If you can, and there's availability for vaccines, then you basically don't get vaccinated if you are actively infected, and you can resume or start soon thereafter. But in the setting of limited vaccine doses, then deferring and getting vaccinated in 60 to 90 days might give other people the opportunity that don't have that very temporary immunity that people who just recovered have.
The one thing I would add to that also is that with the AstraZeneca vaccine, especially an interval between 6 to 12 weeks in between the first and second dose has shown that the second dose has added benefit still. So just knowing that that interval could be that long in between your first and second vaccine, I think is a helpful piece of information to answer that question as well.
Thank you. We have a number of questions about certain categories of people and whether it's safe for them to get vaccinated. So pregnant women, cancer patients who are undergoing chemo and radiotherapy, someone who's had a traumatic brain injury, for example. How do you guys think about vaccinating patients in these categories or other high-risk categories?
High-risk categories are probably even more important in the sense that they are at high risk for severe COVID-19 disease and death. So I think in general, people with comorbidities, people with obesity, hypertension, transplants, you name it, and those folks are as important as people above the age of 65 or above the age of 50 who are also at risk of progression. So definitely try to vaccinate those as well. And they were represented in the studies too.
Yeah, those are the patients that are the most vulnerable. And so making sure that they're vaccinated and protected from severe illness is extremely important. And there has been shown to be safety with pregnancy and taking the vaccine. And as well, there have been documented, as this is being studied more with the vaccines and seeing antibody production in breast milk. Meaning that there is likely some transmission to the baby as well as far as protection. And so I think that's really important to know. And that's exciting information that there is passive immunity happening in that scenario as well.
So are there any categories that you would recommend should defer getting vaccinated or should consult a physician before booking their vaccine?
Mainly folks with a history of severe allergies. If you have a severe allergy and you're not sure if it's safe to get any of these vaccines because of that allergy, that's where talking to a physician to put it in context would be best.
That's very helpful. Thank you. There's another follow-up question on the AstraZeneca vaccine from Tammy Hanfi. And I believe, Dr. Nahreen, you had answered this. The second dose in Bangladesh is scheduled 8 weeks after the first. Is it all right to delay that up to 10 or 12 weeks?
It is okay to delay it, yes.
Great. Thank you. So I'm just curious, what about patients, just following up on the last question, what about patients who have autoimmune disease? Are there any special concerns around patients in that category and getting vaccinated? Does that fall in the same category as patients with allergies, or is that all right?
So that would be all right as well.
Yeah, exactly. I was going to say the same. In fact, patients with autoimmune diseases are often patients who are taking medications that suppress or decrease their immune system. So they're especially high risk as well for those folks that should be getting the vaccine to protect them because they have a chance of becoming severely ill if they were to get COVID.
Great. Very helpful. Very helpful. I know there's some anxiety among patients with these conditions, but what I'm hearing is that it's all the more important for these high-risk categories to protect themselves. How do you respond? Sorry.
No, I was just going to add to that I think the thing that always comes to my mind when we talk about the risk and benefit is, we see so many people that are sick in the hospital and the different types of ways that COVID can present and how sick it can make people and for how long. We've seen patients that were in the hospital for maybe a few days, but they're still feeling unwell for months, if not up to a year. People that are feeling fatigued and tired and not coming back to their normal self for a very long period of time. And so to prevent that life-changing disease, the vaccine in that scenario, when you think about it that way, that even just 1 or 2 days of not feeling well after taking the vaccine is much, much better than feeling unwell for a year from a disease that can completely change your life.
I totally agree. When I had my vaccine, I actually experienced pretty bad side effects for like my first 24 hours was fine. And then for 48 hours, I was virtually immobile. And all I could think is at least I knew it was going to end and it was a small price to pay compared to people who are suffering these longer term symptoms. How do you respond when people say that the vaccine modifies the DNA? Is that true?
Not at all. Our body basically is, our cells are a factory, and they create proteins. And what these different vaccines do is they use that factory to create proteins as well. In this case, proteins that are going to present, parts of the coronavirus to your immune system and develop immunity. So that's another important part with regards to safety. People sometimes ask, does the vaccine have coronavirus? Is it coronavirus? And the answer is no. These vaccines are so advanced that now we're not even presenting people with the coronavirus itself. These vaccines, deliver the code to create a protein, the spike protein of the coronavirus, rather than the coronavirus, in any shape or form. So it's a very effective way to show the mugshot of the coronavirus, which is the spike protein. And when the actual thief comes in, your immune system recognizes based on that mugshot and protects you against it.
That's a great explanation for us non-doctors and non-scientists. Thank you. There's a question actually that relates to treatment that I hope maybe some of you might be able to answer. Perhaps Dr. Azad. There's a Praava patient who has been testing positive for COVID for 2 weeks and is wondering if I believe it's a gentleman, can do some exercises like freehand push-ups, even though he's still weak.
Well, I will
Dr.
say
Azad?
one thing with regards
Yeah.
to that, which is that I would defer
Basically, I
retesting.
advise my
There might be a bit
Sorry.
of a delay.
patients, uh, some post-COVID patients develop severe failure, heart failure, who admitted again in the hospital and die. Basically, I advise them to not to take too many stress uh, during the COVID period, and as long as he or she can tolerate the exercise, uh, that she can take part. Otherwise, if he or she feels exertional breathlessness, immediately stop the exercise.
And I
Very
just wanted to
helpful. Thank you.
clarify that retesting isn't something that is helpful. These PCR tests are very, sensitive in finding, pieces of the virus. That's really what it's meant to do. It defines and replicates the PCR to, the pieces of the virus until the test turns positive on the machine. So once you have convalesced from the illness,
And
retesting might find essentially dead, non-replicating viral particles. And, earlier, before we understood how this virus replicates and behaves, etc., in the nose, we would retest physicians on a weekly basis before they would return to work. And some folks remain positive for months. Some for weeks, some for months. So retesting and testing until you're negative is not something that is recommended.
So then how do you know if you're able to go back to work or no longer spreading the virus?
In general, people are no longer spreading the virus after 10 days. If they have convalesced and they're doing okay. For people who have immune conditions, then 20 days is the day. But that's called a time-based strategy to quarantine. A test-based strategy is not recommended.
Okay. Thank you. That's very helpful. So how do you think about the future of the vaccine? Do you think that we'll need to get another, even if people who have gotten fully vaccinated will need to have another dose in another 6 months, in another year? maybe every year like we do for the flu shot. We realize that, I think many of us realize that the science is still learning, but what is your view on this as experts in the field?
Yeah, I do foresee, I'd love to hear from Alfredo as well, but I do foresee that there will likely be a booster, if not a yearly vaccine, at least for now. And most of that is just early on based on what we're seeing. It's possible that that might change as we get more information regarding the length of immunity and the circulating strain of virus. And I think that is really going to be dependent on how well we contain what's happening now. So I think still a bit of an unanswered question, but it's very possible that we may be seeing a yearly vaccine for this.
Yeah, I would second that. In general, we're not sure how long the immunity from these vaccines lasts. So that's the first question. And then the second question is, are the circulating variants, is this still the most effective version of the vaccine for the variants that are circulating in your community or in communities around the world? So I think those two variables are going to help us change the vaccines, and the frequency of that change and the need for the change will depend on, how soon we control all of these cases, which of course will remain difficult.
Silvana, you're muted.
Thank you. Thanks, Dr. Nahreen. I apologize. I was just saying that we're getting a lot of notes of appreciation in the chat. I think everyone is really, including myself, we're all learning a lot from all of you, and really, really grateful for everyone's time. It looks like we might have lost Dr. Azad, unfortunately. So another question I have, and you guys have alluded to this as well. So if after you get both doses of the vaccine, how long until you kind of achieve peak immunity, and does that mean that you're fully protected from the virus?
Well, in general, this is still an unknown with regards to how long you're protected. With regards to when do you kind of achieve peak immunity, the actual timing will depend on the vaccine. So I mentioned how different vaccines have different delivery mechanisms, and it does seem that the mRNA vaccines, from a delivery standpoint, seems to be quite effective, and therefore our immunity tends to react to that relatively quickly. So at 2 weeks of your second dose is when you're considered to be fully protected. That's where the difference between placebo and vaccine was really, really marked and apparent and persistent thereafter. For some of the other vaccines, it varies, 8 weeks, 12 weeks. But in general, to a certain extent, that doesn't matter, because we have to still do what we were doing at week -1. We should still be doing that at week 4 and at week 20. So we still have to continue doing everything in between. With regards to the actual real world data on how the vaccine works with regards to time, so far most recently we have a 6-month data set from Pfizer that shows that it's still pretty good. Most people around the world are just getting vaccinated, so we don't know from a timing standpoint. We expect potentially a year based on lab studies and how we expect the antibodies and T cells, essentially the immunity, to wane with time. But again, we don't know.
Alfredo, just one thing that I wanted you to clarify for everybody. You mentioned, because I think this might be a source of confusion sometimes when we talk about mRNA vaccine, generically, that we're referring to the Pfizer vaccine, we're referring to the Moderna vaccine, but the Johnson & Johnson and Astrozeneca are a different mechanism. So just to clarify that.
Yeah.
I have a question that I think it's important to clarify, and it's embedded in I think some of the comments that Dr. Alfredo just shared. So if I'm vaccinated, am I still possibly a carrier, and can I spread the virus?
So that's another unanswered question, and there's a study that just started that will try to kind of more conclusively prove what happens. In this particular study, teenagers and younger adults, which seem to drive the pandemic throughout the country, really, they will get vaccinated and followed with a weekly PCR test, and about 6,000 individuals initially and 6,000 later. But more importantly, 12,000 close contacts will also be doing the same, getting tested on a weekly basis, and that will conclusively tell us if any one of these people turned positive asymptomatically, and then subsequently if it gave it to other people. We're also going to measure the amount of virus in their noses. But for now, we don't know for sure. We do know
Which
that when you're asymptomatic, you're slightly less able to spread it. We still drive infections because asymptomatic people don't know that they're infected and they're less careful. But in general, we have seen a decrease in infections in places like Israel, and the UK, where vaccination rates are quite high. So we expect that it will impact transmission, but so far we're not sure, and it may still transmit. And one last point on that: the reason why we don't know is because in vaccine studies, we give placebo or vaccine to people and we follow them. And when somebody develops any symptom for COVID, we test them. So that doesn't truly capture asymptomatic individuals.
Right. And I think just to add to that, in understanding that there's still uncertainty, we should err on the side of caution and just say continue the measures of safety with your masking, social distancing, and things like that. That because we don't know about this question of am I still a carrier, and that I think is really important to recognize that because of that uncertainty, it's just safer to continue with the measures that we're all talking about here.
Thank you. I think this issue of asymptomatic carriers is such an important one. We've seen, I'll just share at Praava in the last few days, we do testing for COVID patients or COVID individuals who need a COVID PCR test in order to board a plane, who are planning to travel. These are people who don't feel any symptoms, don't expect a positive result. And just in the last few days, the positive results coming out of those patients are between 10 and 20%. That means that there are many asymptomatic carriers within Bangladesh. And so it's extremely important for anyone who's come in contact with a COVID positive patient to get tested. This is the best way to understand if you're a carrier, if you're inadvertently spreading the virus. And as long as the evidence is not conclusive, as Dr. Alfredo has shared, we don't know yet, even if vaccinated people can be carriers, we all must assume that we can carry the virus. And so absolutely important that until we have more information, until we achieve herd immunity, that we all continue to take all of the same protective measures we've been advised to take for the last year.
Yeah, and I think one of the major important points of that you mentioned, Silvana, is that only 5 million people in Bangladesh, population of some 160 plus million people, are vaccinated. That's a very small amount. That means that the risk is still high for a large population of the people in Bangladesh. And I think that's extremely an important point here. And if you test positive, please isolate at home. Do not go out in public, and especially without a mask. If you're able to stay home, please stay home, isolate yourself. Be upfront with people that you have been in contact with. There is a stigma that's associated with being COVID positive. We can do everything that we can in our power to remain virus-free. Unfortunately, it still happens. So regardless of how you might feel about being COVID positive, what you might think about others thinking and knowing about you being COVID positive, the important thing is safety for everyone. We are, as a human race, we are trying, this is a scenario where we have to try our best to protect each other. And the only way we can get through this is if we work as a collective, if we work as a population to continue to help each other and protect each other. And so if you're positive, reach out to people you have been in contact with. It's really, really important that we prevent the spread. The more that we prevent the spread and the less virus that's circulating in the population, the less the less virus will actually cause disease. It seems like a logical statement, an obvious statement, but the only way to do that is to continue these protective measures. And I know I keep saying that, but it's so, so important.
It can't be said enough, Dr. Nahreen. Thank you so much. I'm going to just ask 2 more questions, and then I'll hand it over to you guys for some closing remarks. One question that's come through is, why do some people have side effects to the vaccine and others do not?
Well, the first thing to recognize is what we call side effects, are sometimes expected. So what is the most common side effect? Pain in your arm. If you inject anything in any arm, I'm sure you'll have some degree of pain. Because it's not normal to have a needle in your arm. The side effects in general are relatively rare. These fevers, muscle aches and things that can happen. If you don't have them, the vaccine is still working. If you do, then it's usually a measure that your immune system just had a more robust reaction towards the vaccine, and it starts to produce the antibodies and everything else that you need. We do know that younger people and women and tend to have higher reactions. Older people with comorbidities, and men tend to have less reactions, and that's just a measure of how strong your immune system is. If you're younger versus older people are less likely to have a reaction to the point that you develop fevers and things like that. So age, medical history, sex, those things can impact the percentage or the likelihood of having some of these side effects. But the important thing is whether you have them or not, you're protected, and if you do have them, it'll go away within a day.
I think it's also, I was reading something that was saying that it's also important to be well rested and well hydrated, going into the vaccine. So I think that's something that we can all do to try to reduce our side effects. The very last question is a really important one. I think there's a comment that the majority of people who are getting infected in Bangladesh have already gotten their first dose of the vaccine. I would just like to clarify, I don't know the source of that information. I'm not aware of any such evidence. And I think Dr. Azad also mentioned that he's not aware of that. But the question is there any chance of getting the virus from the vaccine itself?
No, there's no, the vaccine
Okay.
itself has no,
Thank you.
is not coronavirus. So the vaccine Astrozenica has a weak vector virus called chimpanzee adenovirus that carries the protein that'll, the information of that spike protein, but you're not going to get COVID from the vaccine itself.
Yeah,
Thank you.
The issue that's happening is that after the first vaccine, in many countries, this is not just limited to Bangladesh, but we're seeing that in the US as well, that you remember that the percentage of protection increases with that second dose. And again, it's still not 100%. After the first dose, it's something like 50%, 50 to 70%, something like that for AstraZeneca, and it ranges because of several reasons. But in general, just knowing that means that if you got your first vaccine, it doesn't mean that you can go out there and be in a social gathering without a mask. You are not fully protected. And because of that, I think that false sense of security is why we're seeing that increased number of COVID potentially as an explanation in patients or people who have gotten their first vaccine.
That's a great point. Thank you. Thank you so much. So don't get overconfident if you get your first dose or even your second dose of the vaccine. I think we all have to take our responsibility. I think it's partly each of our individual responsibility to get vaccinated to help our communities achieve herd immunity, but we can't take for granted that it's going to protect us 100% until we have more immunity in our communities. I really am so grateful to all of you. I apologize and regret that we've lost Dr. Azad, but would like to just ask Dr. Alfredo and Dr. Nahreen if there's any closing remarks you'd like to share with the audience, and really thank you. We're very grateful for your time.
The last thing I would say is that, first of all, we know it's hard. It's been a year of this, a year plus. It's been a very, very long road for everyone. Everyone has had their struggles this past year. Being in the healthcare field, we have been working nonstop to try and limit this. And people that are not in healthcare have been working nonstop to stay home and to try and stay safe. So we understand that it's reaching a critical point that people don't want to do this anymore. But, the hope of the vaccine is there. Don't lose hope. There is hope because the evidence has been pretty good so far. We always knew it wasn't going to be 100%, but we're pretty confident that we'll be able to eventually move back towards having a little bit more normalcy. I think we're still far from that. We still have a ways to go. So hang in there. keep doing what you're doing to stay safe. Things will get better in time. We just have to be patient and continue doing these things to protect each other. Wear your mask, distance from each other, and please, please avoid big social gatherings. It's so, so important. We want you all to be safe, and we are thinking of you, Bangladesh, and hoping that things will improve soon.
Yeah, I would say I would
Thank
echo
you.
the same. I think in general, we still have a long road ahead. I don't know what is at the end of that road, with regards to what stays and what doesn't, and how, what we do is going to impact everything. And, masking, staying safe, socially distancing, those things will have to be done for some time. And I think we have to learn how to navigate our environment, the environment around us, while staying protected. Because it's not just you; it's the people around you. The fact that anybody can be infected and not have symptoms, or transmitted before they have symptoms, means that you could be around someone and get it, but also that you can give it to somebody else. And the vaccine is an important tool in making sure that you stay safe. And if you have access to it, you should certainly go for it.
Thank you. Thank you both so much for your time. And we'll express our thanks to Dr. Azad as well. And really appreciate so many people joining us today and asking such probing questions. I think we've all learned something. At least I certainly have. I really want to say that we're all praying for the country and for the world. And let's each do our part to keep ourselves and our communities safe. Thank you all so much, and have a wonderful evening.